Good afternoon, this is Dr. Do again. This video is quarantine special edition video number 30. Today I'm going to talk the ear infection because summer is here. You all heard about the swimmer ear, which is the otitis externa, and also it's still weird heading to summer. The temperature is still fluctuated. I think otitis media is still occurring, even though hydrating in the winter, but still in the summer or late spring still could happen. So I'm just going to talk about the ear infection, which is quite common. For the otitis externa, it's usually in young people or people with comorbidities like diabetes. They tend to have this. And especially for those swimmers, that's why it's called swimmers' ears. Before I talk about details of these two diseases, I'll just give you some briefly idea of what is the internal ear, middle ear, internal ear, and also the external. The ear refers to the canal separated by the tympanic membrane. Okay. Outside the tympanic membrane is called exterior, and inside of this middle and inner ear. Okay, so otitis externa refers to the inflammation of the ear canal outside of the tympanic membrane. You probably think it's only the causative bacteria. Sometimes it could be very serious, which is the Pseudomonas, especially for those who have chronic disease or the pool or the water, because these Pseudomonas sometimes tend to grow in this wet environment and could be serious to invade inside across the tympanic membrane. And so this is why I like to talk about the otitis externa. What are the signs you feel pain? Ear pain, of course, and you know you're a swimmer, and in the summer you feel your ear pain. You probably know it if you're a swimmer, because it's high rate in those frequently swimmer. So then you see your physician. Sometimes might have the discharge, sometimes may not. The discharge is not from the inside of the tympanic membrane, but outside of just the canal. A little something like abscess or the fluid accumulated, so that's in the ear canal that causes infected. How to treat it? You can you manage at home? No. Do you need to go to the emergency? If you have diabetes, if you feel the pain extended to the not just the ear canal, to the seems like your jaw is painful, and if that's the case, high fever cannot be controlled, that means might have some serious problem. It's possible it happened in some diabetes patient, because the sensation is not that like everybody else with can feel pain regularly, but they do not feel the pain until the pain is really severe, cause the bone infection, the skull. So that if that's the case, mastoid, for example, can be infected. If that's the case, you need to see the emergency. For the otitis externa, usually managed electively, just I mean you can wait. Call your physician, go see your physician as a regular visit, and you will be prescribed medication to treat it. And preventive, how to prevent it? Try to dry your ear after each swimming, and I'm sure if you are a swimmer, you know how to jump and to get rid of the fluid, and do not use Q-tip. That's the take-home message. For the otitis media, usually occur in young children because there's some bacteria tend to infect young children. Even when children cannot communicate and cannot talk, they just picking on the ears and crying and the fever. it's quite common and it can be recurrent. So if that's the case, if you're a young mother, you have little children, I'm sure if you probably know it, or the physician already told you, if your kids has a fever without identified reason and scratching ears, so that's probably a sign. Go to the physician's office to get treated. Anything to otitis media, you need to see if emergency room. Sometimes it could get confused, either especially for young children, upper respiratory tract infection, viral infection, or the ear infection. The fever is kind of tough, cannot be brought down regardless what kind of medication you use. Use Tylenol, Motrin intermittently, still fever is still there for a couple of days, and the kids just cannot stop crying. If that's the case, either going to the emergency or to your physician's office to get examined, because there's a special equipment to look in the ear, you know that. So physician can see it whether there's an ear infection or not. If it is, usually it's bacteria cause for the otitis media, need to be treated with antibiotics. So this is very straightforward. It's quite common. So I brought here for those chronic otitis media. I'm sure your physician already told you. Sometimes might have the fluid come out. You just need to pay attention. If you may or may not have fever, but if you notice, it could be very painful, or could just symptomatic, have the fluid coming out. If that's the case, you need to bring your kid back to the office to see the physician and get treated. Or if it is necessary, we'll refer to the ENT physician. Use a special specialist. Get second opinion from the specialist. Will be very helpful in special cases. Alright, so this is the quarantine special edition. Just ear infections, either otitis media or otitis externa. So I hope it helps. Probably you already know it. But thank you for tuning in, and I'll see you next time.